Hey you guys, welcome to my channel. My name is Ashley Marie and today I'm going to talk about, so I'm going to do two videos. This video is going to be about Med-Surg Adult Health 1 if you're at Chamberlain. And then the next video I'm going to talk about, I'm going to link it, I'm going to put it somewhere. I'm going to talk about my clinicals and what to expect and everything you need to know about clinicals. So, let's get into it. Stay tuned. You know how I do. So, y'all, it is hot. It's hot. It's hot in here. It's hot. I'm going to try to do this video where I'm just going through it. Okay. So, y'all, I just finished up Adult Health 1 and I got an A out the class. You know. So I'm so happy because I finally hit my GPA of a 3.7, and if y'all know, I'm trying to get, hold on, let me let it tell y'all. Now I am magna cum laude. I think I can say that right? So you need a 3.7 to a 3.8 for magna cum laude, and then a 3.9 for summa cum laude. So I'm at my goal. I would have been okay with cum laude, but if I can keep and maintain a magna, I think I'm saying this right. Let's try to make it say it to us, y'all.
Magna cum laude.
Okay, magnum cum laude. That's what it was saying. So I'm trying to maintain a good GPA because I do want to get magnum cum laude. I really just want to get cum laude regardless, but if I can go higher, that would be good. So I did get an A out of Adult Health 1, and I'm going to tell you guys what you guys need to focus on. So let's get into it. Let's get into what it is. Let me bring it up on my phone. You guys know. So with Adult Health 1, we do, we do our medication, Med-Cal exam, and that's a pass or fail. And you're allowed to get 2 questions wrong, and it increases as you go on. But for Adult Health 1, you only can get 2 questions wrong, and then you have to take it again. Your first score sticks. So if you fail, that is the score that's going to be on your in the grade book for you. So and then we also take 5 quizzes and 2 exams in the CLE for this class. So the first exam is a part of the first 4 weeks of the class. So whatever you learn in the first 4 weeks, that is the first exam. The second exam is the last 4 weeks in the class. So you don't get a cumulative, final. You get, are you learning what you need to learn? Have you learned something, And then we do our CJE, which is our clinical judgment exam. And that is basically to see where you're at in the program, what you've learned, where you rank in nationals and stuff like that. And I did pretty good on that one too. So, yeah, I'm trying to bring up the grades, y'all. Okay, we took exam 1 in week... Why am I there? We took exam 1 in week 4, and I got, And just to let you know, this is the second time I recorded this video. The first time, I was looking kind of rough, and I was just trying to get y'all a video out, but my sister was like, she said it in a nice way, but it was just like, girl, get it together. So the first exam, I got an 84. And I can't say that the first exam was kind of confusing because I didn't know how to study and I didn't know what to study, or I was just really confused on the whole situation. So I'm kind of proud that I got an 84. My goal was, of course, an A, but hey, I could have failed. So my tips for that was, okay, let me go to my tips. Okay, so with Med-Surg, you have to, Adult Health 1, you have to be, you really do have to be strong in patho. So if you didn't really do, or you passed borderline in patho, you need to get strong with patho. You need to understand the topics that they went over in patho. especially at Chamberlain, because everything, it's like building blocks. Get strong on the topics that you learned in patho. Okay, you passed the class, but if you barely passed the class, you should be every day taking a topic that you weren't strong at and really like focusing in on it and figuring out, like, with patho is more about the signs and symptoms. What is it going to show up? What's going to show up in the patient, you know? What's going on? What's going on? Like, you know, kidney failure, pulmonary embolisms, DVTs, and what else is it? It's a bunch of pneumonia. It's a bunch of diseases that you really do need to get strong on. They're not teaching you these diseases for no reason. They are very common diseases, so you're going to see them again. So you need to get strong on your clinical manifestations, which are like, how's it going to show up in the patient? What are you going to be expecting in the patient with that? So when you get to adult health, you already have that foundation. Now you're focused on, what am I supposed to do to take care of this patient? So adult health pulls from pharm, it pulls from patho, it pulls from health assessment. So you're assessing your patient. From your assessment, what are the clinical manifestations? What are the signs and symptoms your patient is showing? So now you can do a nursing diagnosis based on the patho of it all. Now you also understand how medication works. What is the provider going to prescribe to this patient? What am I looking for? So with adult health, you need to figure out, your focus is on nursing diagnosis, and you also need to know, what am I going to do as a nurse? And is what I'm doing helping this patient, or is this patient declining? What do I do next? So in adult health, I realized that we focus a lot on prioritization. Who am I going to see first? What am I going to do? What is it? You focus a lot on your ABCs, airway, breathing, and circulation. Your Maslow is also important. You need to know that. Understand your Maslows and understand your ABCs. Like, that's going to help you answer your questions with adult health. Knowing your signs and symptoms, especially for electrolytes, knowing your labs. Your lab values are so important. Like, you need to know your lab values. You need to know your sodium. You need to know your potassium, your, calcium. You need to know those lab values. You need to know your hemoglobin, your hematocrit. You need to know lab values by heart. Yes, okay, you say if you worked in healthcare, it's going to be on the paper, you're going to know, blah, 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 blah. But you need to know these things by heart, because you're going to be tested on it as if, say, if you didn't have that resource of it being in front of you. They're going to test you. They're going to give you a case study, and you're going to have to be able to pick out which are your cues. Is this lab value normal? Is it hyper or hypo? What am I going to do? Because it's different treatments for hyper and hypo. So you need to know that. Like, when I tell you, you need to know your lab values, please take the time to know them. Like, at least you should be 2 or 3 a day. 2 to 3 a day. You need to be sticking to 2 or 3 a day. You need know your hemoglobins, your hematocrits, all your electrolytes. Get stronger on your ABGs, because that's all important. Like, you learn them in like fundamentals and patho, but you really need to know them in adult health. I thought I deleted it. Okay. So, another. Why am I doing this? Why are you doing this? Okay, so another thing with adult health, you got to focus on they give you a lot of case study questions. So you get a case study and you're answering like 3 to 5 questions on that one patient. And you're walking through it like, okay. And honestly, it's really the whole nursing process, the ADPI, assessment, nursing diagnosis, plan, implementation, and evaluation, you know. So you should practice on case studies. Like, if you could like go on chat or find like a reliable, like Elsevier. I wouldn't even say Elsevier, but like I like to go on chat. I use chat a lot, and I tell chat exactly what I want. I talk to chat as if I'm talking to the person. Like, this is what I want. Give me case studies. Give me a 3 to 5 step case study focused on these topics, you know, and it'll give it to me. So what you focus on your case study, because you get a lot of case study questions, and in reality, for real, that is just how you're going to be practicing. Like, when you go to your clinical site, you're going to get a patient and you're going to read their chart. That's reading their case study. You're going to figure out, okay, now you got to figure out, okay, what's wrong. If they don't have a diagnosis yet, you're kind of like, okay, what's wrong with the patient? Most likely with adult health, we're on a med-surg floor, so they already have a diagnosis. Now you just got to figure out your nursing diagnosis. Like, what are you gonna do? Yes, you follow all the doctors, the providers' orders, but you know. So focus on case studies for this class. Focus a lot on case studies. Be strong on your patho and be strong on your farm, and also get used to knowing your lab values. So I didn't know that with the first exam, so I kind of just was like, I didn't know what to study. So me taking the first exam, it was more of me just like, okay, I kind of went in there like, I don't know what's gonna happen, but I made a good grade. But the second exam, girl, the second exam, I did pretty good. Let's see. Let's go back. The second exam I made a 90 on the second exam. But that's because I knew exactly what I needed to focus on. So what I'm telling you guys, like, I'm telling you what to focus on. I'm telling you guys, I'm not going to give you my notes because I feel like, one, I can't. And then it kind of is like, you need to create your own notes. That's how you're going to learn. Write your own notes. Do your own notes. Because, yeah, I can give you this and you're going to look over it. But it's nothing better than using your senses, like seeing, writing, feeling, hearing, to really like grasp the concepts and information that you're getting, because you have to take that information and actually like know how to use it. So I made a 90 on the second exam because I understood what I needed to focus on. I know the symptoms, signs and symptoms for certain diseases. I know what kind of medication they're going to use. But now I needed to focus on what are the nursing diagnoses that I can take to take care of this patient, so I can get them back to homeostasis so they can discharge. That's what you need to focus on. Okay? What else? I said nursing diagnosis. Be familiar with your nursing diagnosis, and also know how to prioritize. I got a book. I'll show you in a second. Sorry, y'all. Maintenance. I'll show you the book in a second. Nursing interventions. What are you going to do? Is the patient, you get a lot of, is it indicated or is it contraindicated? Like, what are you doing? What is, okay, when the provider gives you orders because you've been with your patient, is it okay to do this for your patient? Are they good enough? Well, if you're giving them digoxin, right, you got to make sure the apical pulse is, if it's less than 65, I believe, or 60, you don't give digoxin. So with knowing that, okay, it'll ask you, okay, the patient's pulse, the apical pulse is 52, and digoxin is ordered. What are you gonna do? Is it indicated or contraindicated? Is it essential? And what I've learned about those contraindicated, essential, or no, is it a essential, non-essential, or contraindicated. What I've learned about it, it goes back to prioritization. Like, okay, here's it. Maybe I can give you a scenario. Okay, the patient, let's get it. Okay, the patient comes in with dyspnea, coughing, chest pain. Okay, are you going to what is more important? Are you going to treat their chest pain? Are you going to put them on oxygen? Are you going to ask them about how they feel today? Like, what's indicated, what's essential, what's non-essential, what's contradicted. You're going to give them oxygen, right? You're going to hook them up to the EKG, right? You want to know what's going on with their chest. Give them some oxygen, shortness of breath. You're worried about circulation, airway, breathing. Okay, they can breathe, circulation, right? I'm not going to sit here and ask them, how is your relationship with your wife? That's not essential, right? Yeah, they might have anxiety or what their anxiety is about, but you're not going to ask that. Like, you need to know the difference. Like, okay, what is important? What do I need to do immediately, and what is okay for me to do later? Okay? I hope that made sense. You know, I can't think about it off the top of my head. But, okay, and then you also need to know your declining versus improving. Like, okay, I gave my patient that came in with an oxygen saturation of 85, I put him on, I gave him oxygen at 2 liters, right? And now his oxygen is his O2 is at 94. Did he improve or is he declining? He's improving, right? He's improving. So you need to know that, is the patient improving, or is his stats, his vitals improving, or is it declining? Did my interventions work, or do I need to go in a different direction? So you need to know that. Focus on those with the diseases. So you need to make, like, okay, what did we focus on? So altered gas exchange, you need to put down, okay, altered gas exchange is a nursing diagnosis. So you need to put down, okay, what are the interventions, and what does it look like when this patient is improving, when they're having, like, their gas exchange is improving. What does it look like? What does it look like when it's declining? You need to know, okay, what do you do? Write down, what do you do when they're improving? Okay, you obviously going to continue. Okay, now what is something else I can do if what I did the first time wasn't improving? When do I call the healthcare provider because it's no longer something that it's out of my scope of practice, right? So you need to know that. Again, went over there. And then your adult health is focused a lot on multiple choice. So you need to know, when I tell you that, okay, what are the nursing interventions that can help with this patient? They'll ask you something like that. And you need to be able to click everything that I can do to help this patient that has this type of diagnosis. You know, if you get what I mean, like multiple choice. We are heavy on multiple choice now. So you need to be able to know, like, okay, this is what I'm doing. This is what I need to do for this patient. I can also do this, and I can also do that for this patient. Multiple choice is very heavy on this. So then with this class, you also have a CJE, your national test. Everybody takes it. I got a 79 on that exam. So for me, I studied with the Saunders book, which is like the NCLEX book, the blue book. With that, it's kind of like weird when you're trying to study. A lot of teachers tell you to use Elsevier. You could use Elsevier, but I didn't, because Elsevier was kind of like, Elsevier doesn't help me as much. Elsevier, when I'm trying to learn the information, Elsevier isn't helping. It doesn't help me. Oops. Gotta look still cute, y'all. Elsevier just kind of like solidifies that, okay, you know what you're doing. It doesn't help me when I'm trying to learn. What helps me is my chat. and the Saunders book. The Saunders books, it just breaks it down and it gives you everything like straight to the point. It tells you what's going on, what you need to do as a nurse. It's perfect, y'all. It's perfect. So if you don't have an NCLEX book yet and you're in adult health or Med-Surg, you need to get that book out because it is going to help you, like, for real. It's going to help you. Don't get it last minute. But what else can I say about this class? We have a group project. The group project was kind of annoying. Well, I wouldn't even say it was annoying. I don't like working in groups. That's why it was annoying. But we have a group project, and I don't really like working in groups. But with group projects, it teaches you how to work with others. Because you're going to be working with other nurses and providers and other, like, interprofessional, I think I'm saying interprofessional, interpersonal, that word. You're going to be working with others, so you need to know how to work with them. Like, how do you guys work as a team to get this patient better? So with group projects, how do we work together to complete this project and we all get an A? AKA, the patient's getting discharged. So my advice with doing group projects is you need to understand that everybody has a life outside of this. So what I'm saying is, say you're in a hospital, you have your patients, your coworker has their patients, and they have this, but y'all have to focus on one patient. Like, all three of you guys have to focus on one patient, but you guys also have your other patients to worry about. So you need to be mindful that they also have things outside of you to worry about. Like, for example, some of my classmates, they were taking a second class. I was only taking adult health 1, but they were taking another class with adult health. So I had to understand that I'm not going to bother them because they have an exam for another class to worry about. They have quizzes, they have something else to worry about on top of their lab. So sometimes you do pick up the slack, where not even slack, you just have to get the ball rolling before everybody else could actually start pushing on the ball, right? And eventually, when they do have the time to get in, they're gonna help out. So I know a lot of people are like, oh, I reached out to this person, they didn't reach out, but sometimes the work is not going to be distributed evenly. And you have to be able to work as a team to understand that, hey, I got you. Because someday it might be you. I can't get to the phone. I can't respond all the time. I can't get to the exam. Life is a mess for me. I'm trying. Someday, and you will want somebody to give you the same grace. So this is what I learned with working in groups. You need to be able to give grace and understand that, hey, I need to, I'm going to put you where I need to put you. It's called teamwork. So I don't know much else that I can say about it. Me and my group, we did a great job. Everybody understood the assignment. Everybody understood that we are all busy and we all have our lives outside of this. But we got it done, y'all. We got it done. And I just wanted to tell you that if you're in a group and you're upset about something, you need to just understand that sometimes it might be your time to just, I got y'all. Because someday somebody's going to you will want somebody to be like, I got y'all, got you too. But, sorry, I'm all sick, I'm nasally. But, again, that's all I got for you for adult health, y'all. That's all I got for you. And I hope you guys take this information and utilize it. You can reach out to me. I appreciate everybody that has subscribed to my channel. You guys got me in the 400 club of subscribers. I appreciate it. I appreciate you guys liking my videos, sharing my videos, commenting on my videos. Like, I just really do appreciate it. Even when I'm absent for, y'all know I be absent. But I appreciate you guys, and I wish you guys, the future nurses, luck. I'm going to make another video about my clinical experience because I don't want this one to be too long. And what else can I say? again, y'all, just appreciate y'all. Happy Nurses Week. And